and get started here. I see that got Gail here today, and we've got Lita, Dr. Lemberger, Michael Lindsley, Jessica Thompson, Kaylin Roy, Katarina Rice, Crystal Kenyon, Nancy Locke, Tom Gose, and Liz Perez. Anyone who's here whose name I forgot? Oh, Jessica Thompson's here now.
Craig Davenport.
Oh, thank you, Craig. Sorry about that. All right, we do have a quorum here. So has everyone had a chance to review the minutes from January?
Yes.
All right, any changes that need to be made? All right, do we have a motion to approve?
I motion to approve. I need a second.
Second.
Thank you, Dr. Lemberger. All in favor, aye.
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 Any opposed or abstaining? All right, minutes are approved. With that, we will go over to the board member update. And I understand that Dr. Lemberger and Ms. Burkholder will not be renewing their terms. Sad to hear, but Dr. Lemberger, I want to thank you very much for your years of service, including chairing this committee.
No, thank you. Thank you very much. I've been a privilege to be able to participate, and I have thoroughly enjoyed it. And I've seen a lot of progress being made through the transition from, to the MCO and the Better Health Together, and now it's an ASO. So I've just, it's been a pleasure because I'm educated in how administrative things and legislative activities take place. So that's all I wanted to say as far as my last words. Thank you.
Well, thank you again. How long have you been on the committee, Doctor?
Well, I've actually been on the committee for 2 terms, which is 6 years, but I was attending meetings for probably a year and a half before that as a guest, back when Suboxone was coming onto the scene. And I had a practice with opioid addiction medicine. And so I was lending some of my thoughts and experience to the committee at that time. So it's been 7.5-ish years or so. So it's been a while.
And like you said, a lot of changes in that time to this organization.
Yeah,
Yes,
a lot of
thank
things
you.
have changed.
Thank you for your contributions to that changeover with the Suboxone. I really appreciate you. And I know Kim is going to be sad to see you go. And I just want you to know that too, Dr. Lemberger.
Thank you very much. Yeah.
All right, well, guess we'll turn it over to Kaylin Roy on the behavioral health disaster response.
Can everybody hear me all right?
Yep.
Get my notes here. Perfect. Well, yeah, thank you everyone for having me. So today I'll be giving kind of a brief overview of our behavioral health disaster responders group and review some of our recent support efforts. I work for Spokane County in the Community Services Department, Integrated Behavioral Health Care Quality Supervisor within our BHASO division. So just to start off with a brief background of our behavioral health disaster response team, really, I think came about after the Freeman school shooting that occurred back in 2017, which some of our local community mental health providers had responded to. Our organization at the time, which was a BHO, not a BHASO, began getting more involved in organizing a group of local trained responders that are working in the behavioral health field currently to be able to provide assistance and support in the event of or in the case of a disaster or a mass casualty event. So around 2017, 2018, we began working closely with some of our local community agencies and coalitions, holding regular meetings, as well as recruiting behavioral health responder volunteers that were interested in serving in that capacity. We've also been working very closely with Spokane County Emergency Management over the last 2.5 years. Their director, Chandra Fox, has been bringing a lot of different agencies around the county and surrounding counties to develop and implementing a county-wide disaster response plan. So, as you could imagine, there's been a lot of people at the table, kind of developing that plan, refining the plan, and it was 2 years ago, actually this March, where we had a mock exercise that was out at Meade High School up north. The exercise itself was to emulate a school shooting. So we had the assistance of FEMA to help kind of facilitate that process and response, multiple meetings leading up to that exercise. And then for the actual exercise itself, there were multiple entities and agencies involved, EMS, the police, Sheriff's Department, SWAT, local hospitals, our behavioral health partners, to kind of go through an event scenario and be better prepared to respond if and when needed. So any event to that magnitude, as you can imagine, there's a lot of moving parts, a lot of agencies involved, and so try to facilitating it in a helpful manner takes a lot of work, and behavioral health is just one small piece of the puzzle. In recent news, I'd say a lot of you might be familiar with back in last August, our area experienced the Gray and Oregon Road fires, which was pretty devastating to our local communities of Elk and Medical Lake, Washington. And so some of our behavioral health responders were actually called upon to ask and assist at both American Red Cross evacuation centers. One was up at Riverside, and the other one was at the Spokane Falls Community College, where people were displaced or had been impacted by those fires and were basically staying at, getting resources. So that was kind of our most recent deployment, if you will. As mentioned, FEMA plays a big part in our process. So FEMA, again, is a federal emergency management agency. They recently announced that federal funding would be approved for the victims of both fires, and they actually started or developed a disaster resource center in Medical Lake and Elk, which I think they opened their doors at the end of February and are open currently. But we were also asked to go out there for the last 2 weeks just to have a few behavioral health staff on site in the event that anybody was, could benefit from emotional or behavioral health support, working in tandem with our Spokane Sheriff Chaplains Department. Fortunately, FEMA has a great crew out there, so there wasn't a whole lot of need, but I think just having us on site just in case has been always helpful. As we look forward to our next, spring and summer events, we're in conjunction with Spokane County Emergency Management. We're always kind of planning ahead for some of the large events happening within Spokane. So the Bloomsday Run in May, and then also Hoop Fest in early summer. Those are two very large scale events happening within Spokane. So having meetings before those events just to kind of review our plan, even developing some potential staging areas if a disaster center needs to be set up quickly. As far as the responders themselves, as mentioned, they're all within our network and are working in the behavioral health field. A lot of them are master's level clinicians. We do ask that they complete a 6-hour training course in psychological first aid, as well as 2 FEMA courses to be part of our group. One of the the courses in incident command systems. So becoming familiar with kind of the hierarchy of chain of command if a disaster response center is established. And the second course is the National Incident Management System, also known as NIMS. Currently, we're about 40 responders, again, that are volunteers. And yeah, it's just something that our county is really kind of taking the lead on, knowing that it's important to be prepared. And it's nice to see our our community as a whole kind of mobilizing some of these systems in place. Hope we don't ever have to use it, but sometimes we are called to respond. So that, in a nutshell, is kind of the behavioral health disaster response. Do I have any questions?
Hi, Kaylin. It's Gail. I have a question. So other than elk, has there been any other rural county activity, planned activities like in simulations? Or are they considered to be a little bit too small to do that?
Good question. I know that Spokane County Emergency Management was involved in, I think, the Davenport School District, which is rural on Highway 2. Mental health wasn't a part of that exercise, but I know that school district was experiencing, I think, a lot of suicides and some violence. So there was some resources kind of sent to that area. But other than elk and that, to my knowledge, that's kind of where we're at right now. But always planning ahead, hopefully future exercises to be prepared.
Thanks.
Do you feel that meat exercise from a couple of years ago helped prepare for the fires last year? Or is it something, the fires last year, is that just completely different emergency to prepare for?
Good question. I think it was definitely very eye-opening, just because I came onto the county after Freeman, so I didn't get to participate in some of those response efforts. So I think just seeing the magnitude of so many agencies wanting to help, but then organizing them in a fashion where it's not just, hey, everybody show up and utter mayhem. So yeah, I think just understanding the process and the chain of command was very helpful for the fire. And then also our most recent efforts, we don't want to step on toes. If FEMA is running the disaster resource centers, it's very important that we work collaboratively with them and kind of follow their lead. So definitely very, very helpful. Dr. Mike Lumberger, I know that you were at the American Red Cross Evacuation Center, part of the Medical Corps, so good to see you. I think you're on mute.
Yeah, I was just saying that was quite an experience all the way around for everybody. And I think they did an awful lot of good for at least the first few days when it was really very, very busy. And it's too bad that it actually had to be there, but under the circumstances, it really was a benefit to this unfortunate community. So yeah, I was there, you were there.
Any other questions? Yeah.
Well, thank you, Kaylin. It's good to know that there's this level of organization in our community, and especially with last year that it went off, it sounds like, without a hitch. So I'm really glad to hear that, Spokane, we're ahead of the curve with so many other communities, I feel.
Yeah, being proactive, and we've learned a lot from other cities around the country that have experienced, mass events, casualties, and we can learn a lot from those experiences. So yeah, it's kind of a evolving process.
All right, well, I guess at this time we'll turn it over to Ashley.
Andrew, I'm actually going to jump in here. This is Jessica
Okay.
Thompson. I'm going to review the crisis data dashboard for Ashley.
Well, thank you.
So I will jump into that. Crystal, do you happen to have that to bring up? Looks like it's still loading there for a second. So just for the sake of time, we're going to have a brief update today. I wanted to thank Kaylin for all of his efforts on the disaster response. He really took the lead, and it was really great to see our team at work there. Just as all of you shared, I got to go for one day and was very impressed by our team's response. So I'm very excited that we can provide that resource to the community. So in transition, this is the crisis data dashboard for Q4 of 2023, encompassing October through December 2023, so our last quarter. And just going to go over some brief highlights of the crisis data dashboard. We had 271 high utilizers for that quarter, which is about average, no real concerns there. 81 of those were high utilizers of the regional crisis hotline. 190 of those were related to other crisis services that do not fall within ITA investigations. And we did not have any high utilizers of IT investigations, so that was great news. We had 11,993 regional crisis hotline calls, which also is in line with our normal regional crisis hotline calls. That's kind of around where we average most quarters. So nothing too surprising there. We served 4,942 unique individuals within this time. So I'm doing a lot of services out there, and among those, 18,513 total services were provided. So our crisis system is remaining stable and serving a lot of people, making sure that our folks get the services that they need. In terms of mobile crisis response encounters, we had the majority within the Spokane County. I think it's around 8,000 of those. Which is no surprise because our rural counties have a smaller population. When we look at investigation outcomes, we had a large portion of the investigations were initial detentions, and then another large portion was diverted to other resources. And we do like to see when we can divert individuals to other lower levels of care rather than involuntary treatment act services. So that is a great number to see. Overall, things are remaining really steady. The regional crisis line remains in contractual limits, answering calls quickly and responding to individuals in their time of need. So I think that's about all I have for our crisis data dashboard, unless there's any questions.
Did this get mailed out or emailed out, or will it get emailed out?
It can be shared with any documents from this meeting, as well as it's on our website as well. Okay. It should be dated. I think we put this in the Q3 on there recently, so it should be up to date.
Not a question, but I really appreciate having this data. It is amazing how many people are served and how many calls are received just in a quarter, right? Those numbers show that these are services that are absolutely needed, and glad to see that they're being utilized.
Absolutely. Thank you. Big shout out to our crisis providers that are out there doing the hard work on this.
All right, any other questions?
Thank you all.
Thank you, Jessica. So legislative updates.
All right.
Ashley.
Yes. And I don't know, can you guys see me or not?
Yes.
Yes.
Yes. Okay, perfect. And I apologize. I'm getting done with a meeting in the community, so you're getting me from my car today, but I'm happy to be here and provide a few different updates on a few different topics here. The first one being legislative updates. Session just closed a couple weeks ago, and so we've been keeping apprised of the different legislative bills that have been coming through that have impact to our system of care. One of those bills being House Bill 2088. This was a bill specific to crisis worker liability protections. And essentially it extends the liability protections for responders dispatched from mobile rapid response crisis teams and community-based crisis teams. So it's just aligning the same protections that we have for our call center staff to those teams that are going to be dispatching into the community. Another bill that has impact on our behavioral health system of care is House Bill 1877, and that's an act relating to improving Washington State behavioral health system for better coordination and recognition with the Indian behavioral health system. And so there's quite a few different aspects of this bill that incorporates better care coordination and communication with the tribes or Indian healthcare providers, and it allows the tribes to be able to intervene in the court proceedings when it comes to involuntary treatment and be a part of that process. It adds that Indian healthcare providers can be one of those individuals that clear someone for medical clearance for certain types of evaluations or treatment. There's information about communicating with the Indian healthcare provider or a tribe when someone is going to be placed on an involuntary order that's outpatient, such as assisted outpatient treatment or least restrictive treatment alternative order. And it has some guidelines regarding communication with the tribe and how soon that should occur and in what manner that should occur. Also includes providing paperwork pursuant to any detention paperwork that is happening, that the tribes also have access to a copy of that so that they can intervene in any court proceeding if they so choose, as well as establishes that the Healthcare Authority, in consultation with the tribes and Indian healthcare providers and the American Indian Health Commission, work on developing a training that's culturally appropriate for cultural appropriate evaluations of Alaska Natives or American Indians. So there's a lot packed into that one. We're still kind of going through and assessing all the changes and making sure that we're prepared to implement those into our crisis system of care. The next one is Senate Bill 6251, and that one's related to coordinating regional behavioral health or behavioral crisis response and suicide prevention services. And it relates to Department of Health and 988 and the hubs that they get to designate, and essentially adds in the BHASOs as being able to provide recommendations and provide feedback to that process to incorporate regional input on those decisions that are being made and giving a voice to that. So we were looking forward to how that process goes moving forward with 988 designation hubs. Of course, in Spokane, we have Frontier Behavioral Health, who does both the regional crisis line and 988. Another bill that we had our eye on was Senate Bill 6228, and that's concerning treatment of substance use disorders. And this one has to do with authorization of inpatient or residential substance use treatment, essentially indicating that a health plan or an MCO must authorize the treatment if it meets that criteria for a minimum of 14 days from the start of treatment. It originally started at 29 days, but it got pared down to 14 days. And a lot of other bills that maybe didn't get passed through, it looks like language got added to this bill, which passed. One of those things is having the Healthcare Authority to conduct a feasibility study for creating a network of peer-led trauma-informed non-emergency transport providers for behavioral health services for clients under Medicaid, and to provide that study to legislator by December of this year. There's also that the Healthcare Authority must engage in a gap analysis to the governor and legislator by December of this year, again on non-emergency transport benefits provided to Medicaid enrolled individuals in Washington, Oregon, and other comparable states, and essentially to do that gap analysis and consider cost benefit and alternatives for non-emergency transport. And another part of that was added in, that was in another bill, and for some reason, it's not coming to my mind, but it does state that the Healthcare Authority will contract with the Washington Association of Designated Crisis Responders to develop a training for emergency department social workers with responsibilities related to the involuntary civil commitment by July of next year, and for that to be implemented by July of the following year of 2026. Quite a few different bills, kind of engaging in different levels and different areas of care in our region. I will pause there because that was quite a few different ones I just went over. If there's any questions or comments on any of those.
Hey, Ashley, it's Gail. I have a question. And that
Yeah.
the bill about MCO reduction of the authorization dates or times, I didn't follow that. I didn't get a chance to follow that one. So what was the reasoning of reducing it from 28 or 29 days down to 14?
Yeah, and I don't think it, just to be clear, it wasn't that it has been 29 or 28 days, the authorization. I think when the bill initially came out, that's what was the proposed language in the bill, but then it got reduced down to 14 days. I wasn't able to track that as closely, but I believe some of that reasoning is related to ensuring that medical necessity is evaluated at appropriate times and people aren't being kept in treatment longer than necessary. But also, I think the bill is also advocating for ensuring that people who need a certain level of care are receiving that with less maybe burden on the treatment providers to do those authorizations at a certain period of time.
Just seems like quite a bit of shorter time, but anyway, I'll take a look at the bill.
Yeah. I'm not sure all the conversations that happened around that, but like I said, there was a lot kind of amended to this bill before it passed, so I'm guessing a lot of kind of back and forth occurred on it.
The bill involving the tribes being involved in civil commitments is really interesting to me. Do we know if the Spokane or Colville or Yakima were involved in that bill, and if they're going to be active here in Spokane after that?
I'm not yet sure. I recently was meeting with the Spokane Tribe of Indians, and I think they're aware of the legislation, but I think we're all still looking at the implications and kind of what it allows and the timeframes of when it is allowed. To my knowledge, I don't know if they have direct involvement in the legislation itself, or if it was a more state-led attempt of changing the system, amending the system for better coordination and care.
Any talk of the Spokane tribe or other tribes that you've heard having their own crisis responders or applying for having bed certifications?
That's a great question. I know that a tribe on the west side did designate their first tribal designated crisis responder. I have not heard of that in our region. I know that, one of the barriers to that is staffing, and then also working out the legalities of the court system, whether it's the tribal court system or navigating within the superior court system. But this bill does allow for better engagement with the tribes with our superior court system, and so it'll be interesting to see what might come from that.
Well, thank you. That'll be an interesting new opportunity.
Absolutely. I'm sure we'll keep you guys updated as we become more involved in looking how this is going to impact day-to-day functionings of those processes.
Other questions on the legislative updates? I think you're good to proceed, Ashley.
All right, so the next order of business, I believe it was last BHAB, we talked about the REACH program, which is the Youth Navigator program that has several different components, one of those being a steering committee to develop regional action items related to youth and the behavioral health system of care. Those have been happening. One of the main action items that has been identified first in our region is access to care. And I'm sure we all know about that experience, that access to care is so important to the process and challenging to navigate the systems of care that we have in place. The other part of that is the multi-system team meetings or multidisciplinary team meetings. And I'm happy to announce that we actually received our first referral for that after doing a soft launch with the priority population, which is individuals in hospitals and non-treatment settings, essentially on medical floors or in the ER, who don't necessarily need to be admitted to that level of care, but there's a lack of resource connection happening for that individual. And so we will be holding our first MST this week. So we're excited to see how that goes and get the ball rolling on that direction to be able to provide that service to the community. And we have also hired our first case manager for the REACH program that will assist Stephanie Sorensen, our program manager, in managing the cases for the individuals involved in the program and connecting to appropriate services. And so I just wanted to provide that update. Are there any questions or comments on that? Not seeing any. I can move on to the next topic that we have, which is the Washington Behavioral Health Conference. It's my understanding that in years previous, the ASO has put out to the BHAB members that if they would like to attend the Behavioral Health Conference, that is something we will provide funding for not only attendance, but for lodging. So we are putting that out to the group again, that if anyone is interested in attending the Washington Behavioral Health Conference in June in Kennewick, I think it's the 13th and the 14th are the days of the conference, a Thursday and a Friday, that is open. And if interested, if you could please let us know by April 8th, that would be greatly appreciated so we can get all accommodations set in stone before it gets too busy down in that area. And
Thank you. That sounds like a wonderful opportunity, and I appreciate you keeping us updated on the REACH program. That's when we first heard about it here is really interesting, and I'm glad to keep getting those updates.
Of course, not a problem.
Any questions before we finish up with Ashley? All right, thank you, Ashley. We will go to Tom for the CCP update.
Thank you.
Have here are my CCP minutes from January and February. First, I'll do January. At this meeting, our guests were Kaylin Roy, liaison to the BHASO and CCP. Brent Smith, CCP chair, facilitated the meeting. Also attending were CCP members Tom Goss, Aaron Smith, Robin Segner, Sarah Leak, and Sophia Gunn. Gail Kogo had an excused absence. The online January 2024 CCP meeting was called to order. The December 2023 CCP meeting minutes were read and approved. There was no December Behavioral Health Advisory Board meeting, so this was not reported on. It was noted the CCP December 9, 2023 SAN event was canceled because the roof caved in at the Quality Inn where we were going to hold the event. We discussed the coming Jaunt in June, a walk-in event put on by the CCP. Brent said that he has a lot of flyers for the event, which the CCP can put on cars and parking lots, and that he would like more flyers. Sophia also said she needs copies of the Jaunt flyers. Aaron said that we can contact Crim2 to see if they can film the event. It was mentioned that Windermere Real Estate has a community calendar page where we can advertise for the Jaunt. It was also mentioned that we may be able to advertise for the event on the Spokane Review or Inlander for free. Brent then said that we have signs for the Jaunt, but they need to be attached to sticks. We also may have pre-pandemic posters that Carlos Savali should know about. It was noted that EW has plans to have a table at the event, and that the Humane Society, Scraps, Spokane and Paws may attend also. It was mentioned that we should try to remember which business or providers had a table last year and try to invite them. Robin said that there's information about the Jaunt on the CCP book Facebook page, and there's also information on this page about becoming a CCP member. Kaylin said that we do not have any information about the CCP budget request yet. He said that we may know by February. Next CCP meeting will be held online on Monday, February 12th, 2024 from noon to 1 p.m. Meeting was adjourned. And I have here my minutes from February. At this meeting, our guests were Kaylin Roy, liaison to the BHASO and CCP, and Gail Kogo of the Office of Behavioral Health Advocacy. Brent Smith, CCP chair, facilitated the meeting. Also attending were CCP members Tom Ghost, Aaron Smith, Robin Segner, Sarah Lee, and Sophia Alexander. The online February CCP meeting was called to order. The January 2024 CCP meeting minutes were read and approved. We discussed the January Behavioral Health Advisory Board meeting. At this meeting, there was a presentation about the Opioid Abatement Council and Opioid Settlement Funds survey results by Jessica Thompson. The first meeting for this was October 30th, 2023. The council is made up of the counties and municipalities in the region. There are different stages of how to spend funds. There were 201 responses in Spokane County. The survey results are 77% complete. 105 of the responders were professionals in the field. The first priority was provided for people in treatment. The second priority was the treatment of opiate disorders. The third priority was the treatment as it relates to criminal justice. Also mentioned was the importance of the support of first responders, the support of the needs of pregnant women, the support of community education. There was administrative updates at this meeting also. The Recovery Navigator Program, RNP, was reported on by Ashley McGee. She said that in all 6 counties have been successful with RNP and that providers are implementing plans. There was a mobile response stabilization service update by Ashley McGee also. She said that the youth-based team engages in long support family and youth in crisis. The team stayed with the family for up to 8 weeks. They try to detect problems early. There was a Youth Behavioral Health Navigator Program, or REACH, Resource Engagement for Adolescents and Children, update by Josh Henderson. This program received contract on July 1st, 2023. It has been effective. The program deals with how youth and family connect, how to improve care, and how to access provider services. The program tries to get youth out of the hospital and into the community. It was then mentioned that the Behavioral Health Advisory Board chair and vice chair will be decided by email. The CCP was informed that its budget is now $500 instead of $300. We discussed the coming John Shoe, a walk-in event put on by the CCP. Brent said that he will contact Frontier Behavioral Health about the event. It was suggested that we purchase a banner to use for the John and other events. The banner will read Consumer Consultation Panel, nothing else. It was suggested the banner be 10 feet by 2 feet. Also, we need to contact vendors who might participate in the John. It was mentioned that we should try to invite WellPoint, Catholic Charities, Spokane, Lutheran Services, and Community Health Plan of Washington, the Evergreen Club. It was then suggested that we wait until 2025 to purchase new t-shirts for the panel. Brent suggested that by the end of May, after we have asked permission, we go to the parking lot of FBH and put giant flyers on the window shields of cars. It was noted that we don't have to make signs for the John because we have enough. However, we may need to attach some signs to sticks. It was mentioned that we may need rings or grommets to attach the banner to a post. It was then mentioned that CCP has openings for 4 people aged 18 and over and 2 openings for people aged 18 to 24. It was suggested that we find out if there's going to be a Hands Across the Falls event this year and if the CCP going to have a table at the event. Robin said that there's information about the jaunt and becoming a CCP member on the CCP Facebook page. Next CCP meeting will be held online on Monday, March 11th, 2024 from noon to 1 p.m. Meeting was adjourned. Those are my minutes.
Thank you, Tom. Any questions for Tom on the CCP? All right, so the next thing on the agenda is, before we go to comments, is to discuss when to do our next meeting. Our next meeting would fall on the Monday that Memorial Day is observed. There's a question of whether or not we want to defer that meeting until July. Any questions or comments about that?
I would say that deferring it to July is a long period of time.
Do we want to try and reschedule the meeting to maybe the
May 20th or so?
Yeah, move it a week forward or a week later to June 3rd, 20th or the 3rd. I know I'm open both of those. Anyone have any preferences?
I'm available on the 3rd. I won't be in town on the 20th or available.
Okay.
It looks, excuse me, like our leadership is available on either day. So if we want to push it to the 3rd to have more attendees, we can look at that.
Okay. Well, Nancy, I'll leave it with you to check in with Justin and let's see if we can go for June 3rd, because that sounds like that would work for people.
Okay. We will let everyone know.
All right. Any board or public comments before we adjourn?
Yeah, I've got a question for Jessica. So regarding the opioid settlement funding, we went through all the review process and so on, and I assume that the commissioners have been advised of the recommendations that we came up with. And I'm just wondering, where are we in the timeline of actually seeing some of those funds being put to good use? Do we have any information on that?
Great question, Dr. Limburger. So yes, the Spokane County Board of Commissioners has been updated on everything from the Spokane County survey to the review committee's feedback. We have actually gone there a couple different times to present as they've requested additional information. And all of those are posted publicly on the briefing for the strategic planning website for Spokane County, so you can get more information about on what was actually presented at those meetings and some of the priorities that they're leaning towards. But we don't have any exact timeline right now. We're just really trying to work with leadership to make sure we use the funding available and the funding that's going to be coming in the future to the best of our ability to fill those gaps as identified by the survey as well as the review committee. So I don't have a solid answer for you, but if you do want more information, those briefings will give you a lot more detail on kind of what the board is leaning towards at this time.
Okay, thank you. That kind of gives me a rough idea. It's still fairly early on with actually dispersing the funding then, it sounds like.
Yes, no money has been dispersed by Spokane County thus far. And that's actually the same for a lot of our surrounding counties and municipalities. Everyone's still kind of in those planning stages.
Great, thank you.
You're welcome.
Other questions or comments? All right, do we have a motion to adjourn?
I motion to adjourn.
Thank
I'll
you.
second.
All right, I'm pretty sure everyone's in favor of adjourning. We'll see you all again in June. And Dr. Lemberger, thank you again for all of your years of service on this committee and your decades of service in the community.
And thanks to everybody that's been serving on the committee as well, on the board. You've been a pleasure to be associated with, and I've got good memories of my time on the board. So thank you. Thank you.
Thank you, Dr. Lemberger.
Thank you, Dr. Limburger.
Thanks,
Best.
Dr. Lindbergh. Thanks, Dr. Lindbergh.
Bye now.
Bye.